Well, welcome everyone. I am Michael Morella, Managing Editor of Events at US News and World Report. And today's webinar, we're exploring the topic of developing the healthcare workforce of tomorrow and looking at how hospitals, health systems, and others are working to ensure that their workforces are adaptable, resilient, and diversified. Today's program is part of our ongoing Healthcare of Tomorrow virtual series, where we look at some of the biggest issues and most urgent challenges that healthcare industry leaders are facing, as well as the solutions that they've identified to address them. You can find more at usnews.com/healthcareoftomorrow, and stay tuned for more announcements soon about some upcoming programs we have in store for the fall. A couple of quick notes: we are capturing video of the webinar today, and we'll be making that available after the fact and on usnews.com. We're also simulcasting on the US News Facebook page. If you in the audience have questions, we ask that you please type them into the Q&A feature in Zoom on your screen. Our team will review those and try to give voice to some of them over the course of the hour. Now I am pleased to introduce our panel. With us today are Robin Begley, Chief Executive Officer of the American Organization for Nursing Leadership and Chief Nursing Officer and Senior Vice President for Workforce, the American Hospital Association. Deborah Grimes, System Vice President and Chief Diversity Officer for Ochsner Health. Amer Mumtaz, Vice President of Operations for CareRev. And Sean Smith, Senior Vice President and Chief Human Resources Officer at New York Presbyterian. Thank you all, welcome, and thanks for joining us. Now I will turn it over to our moderator, Kim Castro, Editor and Chief Content Officer at US News and World Report. Kim?
Thank you, Michael, and thanks to our panelists for joining us today. I want to start off by addressing some recent news. The American Hospital Association issued a statement supporting hospitals and health systems that make COVID-19 vaccination mandatory for their employees. Many other hospitals and health organizations are at the forefront of this, including New York Presbyterian. Sean, are you hopeful mandatory vaccinations of employees will have an impact as the Delta variant surges and vaccinations have plateaued in many parts of the US?
I should probably start by unmuting and saying hello to everybody. Absolutely, I certainly think it'll make a huge difference. Our focus on this is really around public health. When we think about the role that healthcare plays, in communities, we certainly wouldn't want patients to come for care and leave with COVID. Not suggesting in any way that our employees, of course, would, transmit COVID, but certainly when we think about the employee safety side as well, there's a lot of throughput in hospitals. So it was the only right decision when we think about community health. I am optimistic that it will make a difference. As we look back through the inception of COVID, certainly our case on March 2, many of our teams were affected. At the high point, we had over 3,000 people who are out, who had potential symptoms of COVID. Certainly, we wanted people to be cautious, and people used a care bank that we put in for this reason. So thinking about that, thinking about the fact that we want our teams to be safe, thinking about the fact that our patients need to be safe, the burden on staffing also when our teams are not well, it's an imperative, I think, to ensure that we're doing the right thing, as it relates to healthcare in New York.
Right. Well, thank you for that. And now I just want to take a quick look back. Deb, you joined Ochsner in your role last March, just before the pandemic hit. What was your own experience like on a personal and on an institutional level?
Well, good afternoon, everyone. As I reflect on my first week here, I had 3 days of normal. And the fourth day, we received our first COVID positive test. And as you know, the world changed for all of us, but it changed really quickly as a new leader here at Ochsner Health. And I can tell you, while I wouldn't recommend it and I wouldn't necessarily want to do it again, I am so proud of the way the city of New Orleans, the way our state really introduced me to the resilience of Louisiana and the way that the state rallied together and just really made me have a sense of comfort and really a sense of relief that no matter where I was in the world, I was going to be going through a pandemic, but I felt very grateful that I was going through it with such a unique group of individuals, and felt very comfortable with the process. On the institutional level, it was really good to see our team really rally together. Our CEO, Warner Thomas, did a fantastic job of identifying early on the priorities of transparency, communicating early and often with the leadership team and our entire employee base, as well as the importance of partnering with others, working with our local hospital associations, working with government, because at the end of the day, we realized that in order to keep our citizens safe and in order to respond to this emergent urgency situation, it was going to take all of us leaning in and working together. And it was a very unique opportunity, but I'm really glad that I went through it with the team. And I can tell you our entire team just worked so closely together. And it was very impressive to me as an outsider. And I felt very privileged to go through it with the team.
Mm-hmm. And Robin, tell us about your own roles leading the American Organization for Nursing Leadership and with the American Hospital Association. Could you share a few big picture insights about healthcare workers at all levels and how they navigated this tumultuous year and a half?
Thank you, Kim. For almost 3 years, I've been serving in this dual role. And, just for the audience's information, the majority of my career has been in nursing leadership, most recently serving as 20 years as chief nursing officer for a health system. So in this role where I am representing my members and hospitals of the AHA, across the board, we saw, as Deborah said, people coming together and working in teams. Healthcare workers stepped up to care for critically ill patients and comfort families and loved ones that many times suffered in isolation. And this was often at significant personal sacrifice to the healthcare workers. In some cases, our workers isolated themselves to protect their families, or they arranged for child or elder care to protect their families. And this was sometimes for days on end. Healthcare workers, I'm so proud of them. They're mission driven, they're dedicated. I will say, though, it's difficult to go home for the day and become engaged in quote unquote normal life activities after seeing so much pain and loss. So resiliency is a key issue that we are confronting. And the chief nurses across the country and hospital leadership folks have just expressed that the duration of this pandemic, 18 months, has been the thing that has been so wearing on our healthcare workers.
Mm-hmm. And Amer, what is CareRev's role in the healthcare staffing and workforce development arena? Can you tell a little bit about what you do and whom you serve?
Yeah, sure. Kim, first of all, thank you for having me here. I'm excited to be a part of this conversation and really honored also to be in a panel with such accomplished and experienced people like Sean, Deborah, and Robin. CareRev is a labor transformation solution. In a nutshell, we connect the demand side of healthcare workforce, i.e. healthcare facilities, all sizes and types, with the supply side of healthcare workforce, which is healthcare professionals, nurses, CNAs, LVNs, respiratory therapists, et cetera. On the facility side, we help our clients optimize their workforce first and foremost, and then we also help them reduce their premium labor spend. And we do this through the use of technology. We streamline workflows, orientation, recruiting, credentialing, et cetera. And we also help them build a local pool of on-demand qualified clinical professionals to help supplant their needs for their internal employees as and when needed. On the professional side, we really aim to be the go-to place for professionals to help them manage their career. We allow them through technology to work in a flexible manner so that they can work as and when they want in a schedule that works for them. And we also give them access to a supportive community of other professionals. So really our role is, in a nutshell, is to try to have a really flexible, low cost and easy to use way of connecting the demand and the supply of healthcare workforce.
And I think that's a good segue into our next topic, which is about workforce challenges and opportunities from COVID. So in many recent US News webinars, hospital and healthcare executives like yourselves have mentioned workforce issues as their biggest challenge, if not the biggest challenge they are facing both in the short and long term. So Sean, are you seeing or hearing this at your own institution?
It's an absolute yes. Going back to reflect on the first wave of COVID, we needed about 6,000 additional staff members. Just the surge alone was so significant. And I'd say we maintained that momentum because people who delayed their care have also kept our hospitals full. And that even now that numbers are down in New York, that is still very much an issue when you think about the fact that some people are rethinking their careers in healthcare. Our healthcare teams have been working the way they have been since March of last year, and they were working hard before that. That what this did was to compound the challenges we already saw, because we even look at 2030. We've all been talking about that. I've been talking about that in my career for the last 25 years, right? The day that we're all seeing coming towards us. And when we look at this and the huge dependency on baby boomers that are part of our workforce, the larger part of our population, we're going to start seeing a lot of movement, which gives us pause because any new grad needs to be trained. Robin and Deborah, I'm sure will have comments about that. But our challenge at this point globally, not just with nursing, when you're thinking about respiratory therapy, lab technologists, I could go on and on, advanced practitioners, they're just simply not enough who are experiencing the calling. And I'm a little worried that the pandemic will actually scare people away. And so a lot of our efforts is around ensuring that we're cultivating pipelines even at the high school level, because we really need to convince people that healthcare is a great and safe place to work.
Great. And yes, we'll be touching on turnover and retirements and burnout very shortly. Robin, are you also hearing the same from your member organizations and clients regarding workforce issues?
Absolutely. It is not the number one priority. As Sean mentioned, in a few statistics here, we had 100,000 permanent RN vacancies prior to the pandemic. So, the numbers, we don't have super current numbers, but we know that, in preliminary reports that we've seen an uptick in retirements, some planned, some early retirements. We have done studies, and we know that the nursing workforce, for example, many are, we know burnout was an issue prior to the pandemic. We know it has only gotten worse. And, some nurses and other healthcare professionals are looking to leave their point of care jobs and find jobs that are further away from direct patient care. And that is very concerning to me as well. Burnout, as I mentioned, was already an issue. And, again, the duration of the pandemic is just complicating and compounding factors. In the short term, people need a break. We all thought, and, we're very optimistic and believe that the summer would be the end of the pandemic. And we know now that that's not the case. We're seeing a resurgence, in areas all over the country. Some healthcare workers, are really ready for their well-deserved retirement, the baby boomers. And the long-term challenge here is the loss of their expertise and experience. And as Sean mentioned, the pipeline is critically important.
So speaking to that, Deb, reports suggest that the pandemic has led to many into early retirements, even in healthcare fields. So what impact might that have on the sector for older workers? Are you offering flexible shifts or other types of part-time jobs?
Robin, thanks so much for those statistics, and you're spot on with all of the things that you identified. I think from my perspective and our organization's perspective, I think in the short term, we have to meet the immediate needs of the staff we have. For instance, early on during the COVID surge, some things that we had to do differently. Overnight, our CHRO and our entire human resource team spent a lot of time securing childcare, because that, as you know, a large part of the workforce in healthcare are women, and women can be the primary caregivers. And so part of the thing is trying to alleviate some of the external stresses and understanding the needs of the family. And then also some short-term goals would be to really highlight healthcare as such a crucial need for our society. I think sometimes we don't, I think one of the things the pandemic did was highlight how critical having healthcare professionals really are, and highlighting them more as heroes, and sort of the everyday ways that we partner to save lives and to help our community. In the long term, I agree with you. We have to also start looking at the workforce in the totality. This is the first time ever we've had 4 generations in the workplace. And for all of us, I'm a nurse also, and I'm going to self-disclose, I'm also a baby boomer. What it takes to motivate me is totally different than what it takes to motivate my millennial daughter or my generational Z son. And then we have the Xers in there in the middle. And so I think we have to, as leaders, equip ourselves to acknowledge the generational differences, and to work really hard on those pipelines early on. We can't even wait to high school anymore. We need to start in middle school, really identifying the array of opportunities that exist in healthcare.
Go ahead, Robin.
Yeah, Deborah, I couldn't agree with you more about the pipeline, and beginning early is key. One key statistic that I failed to mention earlier is that, the AACN, the American Association of Colleges of Nursing, did a survey last year, 2020, during the pandemic. There were 80,000 qualified nursing school applicants who were not accepted into programs because of lack of capacity due to either lack of faculty, lack of clinical placement, and a size of programs. So that's another thing that we really have to work towards, is expanding not only nursing programs but all those other healthcare careers that we know that we are in urgent need of.
Sean?
Thank you, Kim. I'm just going to take the opportunity to throw out, and I know you're going to talk about this a little bit later, how we reskill, how we upskill, how we're also thinking about the internal population. But I also thought it was important to really talk about even the immigrant populations. I think in New York, what we found is there were so many talented people who can't really go to work. And we're partnering with an organization called Adaptable Global. And I'm learning a lot more about those barriers too. Physicians that are not, originally born in this country or not trained in this country, who we cannot mobilize to the bedside. And what we saw in the pandemic is a wake-up call of a necessity for us to really think broader around people who have the skill set, even in terms of administering vaccines, to really start to look at some of those things differently. In many cases, we're restricted by requirements, credentials, that individuals can't get. So I'm very thankful to New York for relaxing rules that allowed us to do things and allowed things to be more fluid. I think we should be thinking about what this could mean, not only in future pandemics, but also how that population or even populations out of different states could really bridge our workforce gap.
Amer?
Yeah, I couldn't echo more what Sean, Deborah, and Robin have said. What we've seen in our experience especially over the last year with the pandemic, is the healthcare workforce challenge is huge. So when we talk to our facilities, our clients, some of the things that they have been struggling with trying to address for the last several years, things we talk about all the time, like patient access, how to be more patient-centered, how to manage costs, how to really make the move to a more of a value-based care model. All of these, when they try to address them, the biggest challenge they find is clinical workforce and how to address the lack of or the challenges with clinical workforce. And we talked about the challenges, right? There is inadequate supply. There's a lot of burnout. The costs are high. I do want to point out that some things that have happened that we've seen in our work over the last year because of the pandemic have really made a difference also. There's been some innovative ideas that have come that have really helped and done what I would call, rather than being able to increase the actual supply of the clinical workforce, actions that have helped increase the effective supply of clinical workforce. So for example, there have been regulatory changes, right? There have been licensing requirements that have been eased. There's been regulatory requirements that different states have eased. And so professionals have been able to go where the need has been a bit more than they were able to do before. In our work, a couple of things that we've sort of been working on with our clients that has made a big difference is really reducing a lot of the friction that is in place when it comes to workforce, when it comes to getting people to work, things like recruiting, credentialing, orientation. With the use of technology, we've really been able to help streamline those, and that has made a big difference. There's a lot of red tape around onboarding and credentialing that we've helped reduce. Then technology has also helped improve flexibility in how and where professionals are able to work. We've also seen with the use of sort of like on-demand platforms like ours, we've also seen changes on in terms of cross-training of professionals. So for example, people who've been working in the ambulatory environment, getting them trained so they can actually work more in acute care environments. Robin mentioned this whole wonderful idea of there's a lack of capacity of getting people to work. So it's not, I think the broader idea, the way I like to think about it is that there's a challenge we have in the short term with a limited amount of supply. And so there are things we can do right now that can increase the effective amount of supply of workforce, clinical workforce. But really the longer term solution is going to require doing really training and like Sean mentioned, getting people, and I think Deborah also mentioned, getting people, younger people interested and attracted to this profession. And I'm going to stop. I know I get excited about this. But I am heartened by the fact that I've seen, for example, that over the last year, since the pandemic started, there's actually been an increase in the number of, like by 6% year over year, an increase in the number of applicants to nursing schools. So people have actually been, young people are inspired by the heroes of the people who've actually been working in the front lines over the last year or so. And we really need to continue sort of giving them that encouragement and finding ways to reach out to them and attract them to this work.
Deb, do you have a final thought before we move on?
The only final thought that I wanted to add is that we also need to be innovative with the staff that we have. We have a lot of employees who are in entry-level positions that are high performing in those positions, and really seeing what percentage of those, if we remove the barrier of time and money, would actually go into to fill these clinical roles. I would say to you, a large majority of those are not in those entry-level positions because they necessarily want to be there for the next 20 years. It has to do with time and money. And we need to maybe think externally. I absolutely agree. We need to increase the pipeline, but internally looking at our own workforce to say, what percentage should we be from a career developing process, remove those barriers. We already know they're high performing. They're already in our organization. We should be utilizing them to move and to fill some of those voids.
Go ahead, Robin.
And I know you wanted that to be the last word, but I just really feel the need to agree with Deborah, and just to mention that, you know, the concept of a career lattice as opposed to a career ladder is one that many organizations across the country are implementing. And it really does look at the entry-level employees that hospitals and health systems have, determining, you know, with them where they want to go and help them get there. You know, time and money definitely are two of the biggest barriers, but we have excellent potential within our own organizations right now.
Sean, I just wanted to quickly ask you, are you seeing shortages of particular kinds of health workers? For years, experts have spotlighted concerns about shortages of primary care physicians and nurses, for example. Are you in need of certain specialists?
So how much time do we have, Kim? We will spend a lot of time just going through all those lists. Look, I want to underscore what Robin said too, and what Deborah said. And your question just really sparks this for me. There's simply not enough healthcare experts out there to fill the jobs that we need in here, right? And when I look at our projection of our needs, I actually amplify that across the country, and the time is now. That being said, shortages exist across allied health. We need as many people to become the technologist who's running the lab test in the hospital, and that's a job that many people don't know a lot about. I don't want to spam with job titles. I'll just name a few as we're thinking about even automation and how technology helps to support this, clinical bedside work. Amir talked about that. So we're also seeing emerging different kinds of roles in healthcare with different skill sets that are necessary that supports the bedside. So a lot of these areas across the board, PAs, CRNAs, are all areas of short supply for us. And I do think that the key is to move our employee population through talent, really managing our talent, ensuring that people can be skilled differently, that we offer opportunities to encourage people to move into areas across and build their careers.
So I think this is a great segue into talking more about the role of technology and improving the patient consumer experience. So Amer, as at-home care and remote monitoring becomes more of the norm, what is working here to properly equip caregivers? Any thoughts on that?
Yeah, sure. I think what I will speak a little bit to our experience. So what we have seen in our experience is that what really helps from both our sides, right? So basically we have two sides of the equation. We work with healthcare facilities and we work with healthcare professionals. And what really works is from the facility side is things that we can do with the use of technology to impact their cost and quality. And then what it works from the professional side is what can we do to improve their ability to be flexible, to help advance their careers, to really help improve the satisfaction they get from their careers. The way it works for us is we use technology, like you mentioned. First of all, we use technology to help them optimize their internal staff first and foremost. That also allows us to then give them a very flexible, local, on-demand sort of a pool of professionals that they're able to get through the use of technology. That, going back to quality and cost purposes, that makes a big difference to how what sort of an impact they see very quickly in terms of performance. And then from the professional standpoint, the use of technology really helps us meet them where they are. So I think we've already spoken a little bit about how to find that the pool of professionals who can work when it might not be convenient for the healthcare facility, but it works for their schedule. And the way we do this is we can, therefore, with the use of technology, we can appeal to people who are close to retirement age, who don't want to work full time, but might want to pick up a little bit of work here and there. We can, I believe somebody already mentioned professionals having constraints of childcare or elderly care, and we can allow the technology to work around their schedule. So that's what we have seen as we've been able to find a latent pool of professionals and really help increase the effective supply of professionals through the use of technology.
Right, and Robin, how will telehealth and virtual care impact staffing? Is there a need to recruit and develop even more tech-savvy workforces because patients will be all the more tech-savvy? What are your thoughts on that?
Great question. Deborah mentioned the 4 generations in the workforce. And although I don't want to stereotype anybody, I think that we have seen in hospitals and health systems for sure that the younger generations are certainly more tech-savvy. And I think even our baby boomers, our baby boomer generation has done a very good job of adapting. Not to say that we don't have to continue to really look for the skills for the future and make sure that we have the training opportunities available for those already in the workforce that may need to do things in a different way. But I agree with Amber that technology is an enhancer, and it really can help make our roles and our difficult days easier. It's all about how we apply it. And, some of the rules, regulations that Amber, or I believe it was Amber, but it might actually have been Sean mentioned earlier, are things that we need to really reevaluate if all of the documentation requirements, for example, are necessary as we move past the pandemic.
And Deb, you already touched briefly on millennials and Gen Z. Are they demanding more on-demand and consumer-friendly services? For example, mobile-first consumers, work-life balance, et cetera. I'd love to hear your thoughts on that.
Yeah, and I think exploring and partnering and prioritizing, hearing from everyone, and really acknowledging that we're not at a point where one size fits all, and really coming up with a multifaceted approach, I think will help everyone. So yes, I've heard that a lot, and I think it's important to do so.
Amer?
Yeah, if I can just speak a little bit to what Robin just said a minute earlier about compliance of regulatory requirements. If I may, I want to give you a couple of real examples in our work with our clients. So we have had challenges working with some of our accounts where they have been struggling to find people to work. And because of their rules, they have actually been pushing back against some individuals, some qualified professionals, because, for example, because the lot number on a vaccination record was not the right number of digits. We've also had another case that literally happened a couple of days ago where a certain account of ours that we worked through this, but they were struggling to find somebody to work for them when they had an individual whose TB test had expired literally 24 hours earlier. These are the kind of things. There are some really good reasons why somebody should not be allowed to work, because there are some real compliance issues, or there's been some issues with their records. But a lot of the red tape associated with this is a real hindrance for us to make do with the really qualified pool of professionals we already have, as opposed to the bigger ones that we really need, like Sean has mentioned several times.
Go ahead, Sean.
Thank you. I just want to interject in the conversation that whether or not we're ready, the world's moving. And If you're purchasing your groceries online, your clothing online, our consumers are expecting that in hospitals. So what's happening across the space, whether we want to or not, is the need for us to ensure that there is a accessible, easy way for patients to have access to your hospital and your physicians. That's going to drive value. It's going to drive value across. People want to see their health information. And so EMRs that are being really contemplated or implemented across the country is changing how work happens. And we're experiencing that. I think also across the country, we're seeing degrees being challenged. We're seeing the notion that technology in and of itself, whether you're learning about Python or AI are critical skill sets, and every college, every group is really thinking about how do they embrace it today. We all have to think about how we ensure that our workforce are not left behind in many of these things. And so on-site availability of programs, ability to expose people, learning on the jobs, but certainly with working with partners like Amir, finding ways of optimizing your workforce. And the way we are doing it is through a program that we're calling Achieve, very focused on what people need as part of a journey around imagining our future. Imagine a world that's much more technology enabled, and what do we need to do in order to ensure that we're supporting that? Some of those are projects, but a big one is how do we actually ensure that access and access needs are cared for, which actually starts a whole sequence of activities for the life cycle of a consumer to patient, in hospital, out of hospital, but that we're thinking about how technology provides the service that people need. So there's an imperative here that I think helps with the conversations, but really requires us to ensure that our teams are being supported through the appropriate level of reskilling methodology.
Thank you. So pivoting on to our next topic of increasing diversity and representation, diversifying staff is a major priority for many health organizations, given that Black, Latino, Native American, and other minority groups also often remain significantly underrepresented. So especially in leadership roles. So Deb, as Ochsner's first Chief of Diversity and Inclusion, can you pinpoint some specific examples and efforts underway to address this diversity gap?
Thank you so much, Kim. I think it's an important question and certainly a very relevant one. I think, and it also relates to what we've been talking about. I think the pandemic really highlighted the fact that health disparities are real. And I think we have to then step back and say, why are we having health disparities? And a big part of that is looking at, is your care delivery practitioners and your leadership, does it look like the community that you're serving? And a lot of times the answer is no. And it doesn't mean that you're a bad organization. It doesn't mean that you haven't been working on it. But I think it comes back to your point. What are we going to do to close that gap? And part of what we're working on here at Ochsner Health is really establishing the fact that we celebrate and we're excited about diversity. And just saying that and having action centered around that from a cultural perspective. And then more specifically, looking at the data to say, with that being said, we may not be as diverse as we want to be or as we need to be at the leadership level. And having a very data-driven approach to that, and then stepping back to say, what types of things are we going to do in a process-driven way to change the metrics? And part of it has to do with recruitment. Are you recruiting in diverse communities? Looking at HBCUs and really developing those pipeline and relationships to say, we want to partner with those schools and we want you to start coming here and looking at us as an institution. The other thing is changing, once you change your recruitment, is really embracing the whole employment process, doing unconscious bias training, making sure that you have a diverse group of individuals for all of your jobs that are before you start the whole interview process. Are you openly recruiting in a transparent way? And then setting those goals of monitoring that process and communicating and celebrating when you hit the mark and the metrics are changing, but also reevaluating when you're not reaching those goals. From an internal perspective, we're looking at having more mentoring, having more sponsorships. We just started a mentoring program called Momentum, where we're identifying high-performing minorities in the organization, getting them ready to be able to compete for those jobs as they come available.
So Deb just mentioned community. Robin, how are you working with businesses, government, schools, advocacy organizations, and other key local partners in all of this?
So the AHA and AONL, first of all, have been very involved with our Institute for Health Equity and Diversity, which is part of our AHA family. And the things that Deborah mentioned, every single one of them is, part of the information that we are sharing with all of our member organizations and individual members, as far as components of a toolkit of what we need to do together. The one thing that Deborah kind of glossed over that I wanted to spend a minute or two, the boards of our organizations, there needs to be an intentional process to include our diverse members. So leadership at the board level, the governance level, it's really critically important that that be a very strategic part of the plan. AONL has a diversity and belonging committee, and what we have set forth is metrics. We want to increase the diversity of our membership, but that really, when you look at nursing leaders come from nurses. So we know, as we look at the population of nurses in our country, for example, we are 90% women, and the vast majority are white women. So, what are the plans that we need to make, or how do we evaluate the plans that we have in place? If they're not meeting the mark, it is going back, partnering with our healthcare organizations and schools. And really, as we mentioned earlier, real early, the middle schools, the early high school years are where we need to have a strong focus. So there's lots of information that I could share from the HA perspective, and everyone is well aware that this is not only the right thing to do, but it makes care better and it makes our health systems better.
Go ahead, Sean.
Thank you. I'll add, our teams would like to see us spend more time on community matters, but I think if we step back as an anchor institution, it means something. It means that there's certain things that we're going to support the communities on, that ranges from how we help communities, how we hire from communities, how we actually ensure that some of our supplies, just from a supplier diversity, I'm sure Deborah could talk about that all day, on how necessary that is. That may seem like something behind the scenes, but many of our community players thrive because they're big businesses in those communities, and we want to support them. Our approach has been, certainly through this anchor lens, to ensure that we're supporting our local communities in New York. We work with programs like CEO Jobs Council, or 27 CEOs that came together and said, we want to hire 100,000 New Yorkers. We want to educate them and ensure that they're in the right job space. And those kinds of programs are really helping us to really drive some of what really walking the talk of the things that we're talking about overall. I just an end on the diversity of our teams. Certainly the cultural awareness and the fabric of that is really what you live. My experience is, people won't stay if your environment isn't inclusive. And our focus around respect has really driven for us a credo that says what we believe in, and at the same time, really try to drive the values. That part of that is the listening, part of that is the inclusion in the work, in all aspects, all fabric, that really allows people to feel part of something greater. And if we don't do that, then we don't feel that even though we might try our best efforts to hire someone, they're not going to stay in your environment. And I can speak on that from my own experience as well, and my own comfort or not, in places that don't really demonstrate the level of inclusiveness, the level of belonging that one should feel, which really, if we think about belonging, has so many components to guide us, which is how, again, people feel.
Amer?
Yeah, I want to echo what everybody said, but I actually want to start off by just looking around this room and saying, just I love the diversity of this room. So I just wanted to point that out. I also want to say I've actually worked in several industries before I started working in healthcare, and there are many things in which healthcare is a little bit behind the times, the use of technology, for instance. But when it comes to diversity, I would actually give it pretty good ratings. I think as an industry, we are definitely very aware of it and try to do a good job with it. From the CareRev perspective, we think about diversity in a number of different ways, and we very actively take steps to address, we do cultural diversity training. We are very heavily look at diversity when it comes to our recruiting processes as well. We haven't really spoken much about gender diversity, but that's something that's really important to us at CareRev as well. We work with, like I said, we work with clinical professionals, nurses, CNAs, LVNs, what have you. And as Robin mentioned, a big majority of them is actually women. And then on the facility side, we work with chief nursing officers, finance leaders, staffing managers, unit managers, HR leaders, and a big portion of them happen to be women as well. So even if it weren't the right thing for us to do, which of course it is, it's actually a critical business imperative for us to be very well represented from a gender perspective and also from a other diversity perspective within our ranks. So we actively work towards it. It's a clear direction from our leadership team. One of our co-founders is a woman. We actually have 3 women in our management team. The vast majority of people who report up to me, who are senior directors or senior managers, are women. So it's not something we are perfect at, but it's something we're actively trying to work on. And I know, just listening to everybody on this panel, I know everybody feels the same way, and we're all trying to work towards it.
Go ahead, Deb.
I think I agree with all of the comments, and I want to just kind of end on this note that I think that diversity is incredibly important. It will come by evolution. It will come by being great. Inclusion cannot happen without a strategy and a commitment from everyone. And I think a lot of times we think of diversity as representation and a standalone thing, but it will not survive and it will not thrive if we don't really lean into this idea of inclusion, because just by its very nature, it's talking about everyone. Because a lot of times we're distilling this down to race, age, and gender, but it's so much more than that. It's really about who's around the table to be a part of decision-making. And not literally, because the table could hold 35,000 people, but figuratively in how we set up all of our processes so that we're involving everyone. And so that everyone has this sense of, in order to be great, it has to reflect the voices of everyone. And so it's spot on to think of it in terms of inclusion is about belonging, it's about respect of everyone. And it's going to take all of us working together.
Thank you. Robin, go ahead.
I just want to echo what Deborah said. A very good friend of mine basically schooled me and said, diversity and being invited isn't the same as feeling like I belong, and that, and that I'm included. And that really stuck with me. I just wanted to make one point about community as well. I don't know if the audience understands that in many communities, particularly rural critical access areas, the healthcare organization, the hospital, is the linchpin of the community and many times the major employer. So I think really we are so mission driven, and that inclusivity of being part of communities large and small is really what healthcare organizations are all about.
Okay. So we're going to have to move on, but we're running out of time. I do want to take one audience question, but before that, I want to ask all four of you, even when things do return to normal, what is most concerning to you all? What keeps you up at night thinking about new variants, the potential long wave of mental health and workforce challenges? So why don't we start with Sean?
Thank you, Kim. I'll just sort of add on that one of the things that I'm certainly thinking a lot about is health justice. We saw great disparity as we went through COVID. It was just a reminder of what was there before. And as we create our Health Justice Center, that is a big imperative for us. But I'll also add, I'm certainly giving a lot of thought to the discussion around who will be here, how we reskill and ensure that we are driving our pipeline needs. The workload in and of itself, in healthcare today is so significant, and our teams are burnt out. And so I worry about the tail of COVID. How do we actually ensure that we're supporting the basic needs of our workforce? How do we build on that around wellness, well-being, resiliency programs, of which we've been spending a lot of time on? But that area is so critical. And the notion of what does it mean to burn out? There a number of the pieces of the conversation we talked about today, even whether or not you can work at the top of your license does matter, but we're working in a changing environment, one that's very stressful, and one that our employees, which is uniquely different in healthcare, all healthcare employees and people everywhere are thinking about COVID when you go to bed and when you wake up at night. It's going to be really important for us to extend tremendous well-being support, a range of support to help our workforce and future workforce members really thrive in this new environment.
Great. Amer, I'd like to go next.
Yeah, sure. Thanks, Kim. I think we have to start off with the awareness that we are nowhere close to being at the end of this pandemic, right? So when we say the new normal is really just going to be more uncertainty, the need for much more care, a far bigger need for qualified healthcare staffing. So we really have, as a society, I think we have to ask ourselves, and I think Sean has mentioned this a few times, where do we stand relative to what our needs are in healthcare? Our demand is going to continue to grow. It was going to grow before the pandemic. It's going to get even worse now. It is growing in an uneven fashion. So how do we actually make sure that it's actually satisfied with some of the more vulnerable communities who haven't had access to care the way they need to so far? And then how do we address that, knowing that our supply of healthcare staffing, healthcare workforce is very limited and is going to continue to get worse if we don't do something about it. And I think the answer is, in the short term, we have to figure out ways to use technology and to use more streamlining of procedures and processes of workflows to really increase what I like to call the effective supply of healthcare workforce. And in the long term, we have to figure out ways to really increase the actual supply of health force and do it in a way that is that doesn't end up with more people being burned out. So we have to do it in a way that we use technology and we use different sort of healthcare delivery models that really put healthcare workforce at the forefront of us trying to solve the healthcare crises in this country, and make them feel valued and really attract more young people to this amazing career.
Robin.
Well said, colleagues. I think that, workforce is what I go to sleep worrying about and what I wake up worrying about. Initially it's the short term, it's recovery and resilience. But beyond that, it is capacity. Well, it's reskilling. It is, what are the new competencies for the new normal that need to be taught in our schools of nursing, of medicine, and every other health profession, and also reskilling our own people that are currently employed in our settings. It's capacity, it's the pipeline, it's making sure our, the workforce of the future is diverse, but also is inclusive, as we mentioned earlier. And finally, I would say that, workforce needs to be part of the longer term strategic plan, not only at an organizational level, but really for our country.
Deb.
I agree with all of my the comments from my colleagues and members of the panel. The only thing I will add, in the short term, we have to remain diligent in responding to this crisis, becoming ambassadors for trying to get as much powerful information about getting vaccinated and how to protect ourselves, because that's the only way our community is going to survive, and that's how our healthcare workforce is going to survive. In the long term, we've got to prepare for the next thing. I think what this pandemic has taught us is that healthcare is hard, it is challenging, and we've got to move, we've got to prepare for what's coming down the pike, whether it's more spikes, whether it's how do we live with the long-term effects of COVID, how do we work on our workforce from a resilience and from a wellness standpoint. So I think in terms of the short term, we've got to survive, and we've got to stay together as a community, learn as much as we can, and try to stay safe.
Great. So we have time for one audience question, and if one of you can weigh in on this, that would be great. Due to the time, mental health providers are very much needed, especially those that can speak another language and understand other cultures in these uncertain times. Can any of you speak to that? Who would like to answer that question?
I would just say yes. I don't know if I have any more insights to add. We are at CareRev definitely seeing a huge increase in the need for healthcare, for mental health professionals, and it's definitely an area that I think deserves much more focus and resourcing going forward than it has had in the past. And the distribution of those resources actually needs to be much more even in society, I think.
Go ahead, Sean.
Okay, I'm just saying absolutely yes, as Amir did, that just thinking about the tail of COVID alone, but I want to just remind everybody that even prior to COVID, there were just huge stressors and burdens that people were really dealing with. And so we were short before. The COVID pandemic just really, quite frankly, exasperates that. But it is an imperative. It is one of those jobs, again, that I think we need to deeply reach into and develop pipelines for and ensure that we have a plan. We're seeing a lot of technological resources come in with different business models. We're going to have to use all of them. But the big question in that range is often, what does it really mean? Because it's really a spectrum. Do I talk to you about yoga and breathing exercise and meditation, or is it more extreme than that? Or is it really about how we as an organization rid of all of the barriers that our teams have to face each day when they're actually at work, i.e. clearing their path so that they can do what their heart really told them to do, to come and work in healthcare.
Thank you. Thank you so much. We are going to close it out here. Thank you so much to our panelists for offering their insight and wisdom today. I felt like this conversation could go on at least another hour. So I encourage our audience to go to usnews.com/health for more up-to-date advice, information, tools, and of course, our best hospitals rankings. On behalf of US News, thank you for your time, and we hope you found this helpful. Have a wonderful week.